ranking member and the chair.
Amen.
Thank you. The gentleman from Pennsylvania, Mr. Keller.
Thank you, Mr. Chairman, and I would like to thank the Secretary also for being here today. Wanted to talk a little bit about community pharmacies, healthcare providers, and we talk about that, to the patients using Medicare Plan D or Part D plan. Price transparency is an essential issue for Americans, particularly people that I represent in central and northeastern Pennsylvania. As has been the case for too long, pharmacy benefit managers, or PBMs, play a significant role in the drug pricing debate with certain anti-competitive tactics that increase patient costs at the pharmacy counter and claw back hundreds of thousands in DIR fees from pharmacies months after drugs have been dispensed, making it difficult to operate the small businesses and making it more difficult for providers to deliver health care. CMS has determined there was, and I found this hard to believe, a 91,500% increase in DIR fees between 2010 and 2019. I think we could all agree that that's pretty much unacceptable growth in these fees. And it creates access issues for many seniors in Part D and increases the possibility of pharmacy deserts across Pennsylvania and the United States. CMS also anticipates that the average growth of pharmacy DIR fees will increase roughly an additional 10% per year. By taking action, we can help save America's seniors up to $9 billion in out-of-pocket costs. So, Mr. Secretary, since you were before the committee last summer, CMS has issued its calendar 2023 Medicare Advantage and Part D proposal rule, which includes, among other things, inclusion of pharmacy price concessions in a definition of a negotiated price, and clarification on the definition of price concessions. These stand to increase transparency for seniors and community pharmacy providers, but more work can be done to close loopholes and reduce unintended consequences. We've heard from many self-insured employers frustrated with the lack of transparency in the pharmaceutical supply chain. Specifically, only 3 PBMs control 3/4 of the market, limiting competition and innovation in the sector. Notably, these 3 PBMs also own or are owned by health insurance companies. Additionally, the PBM business model could create incentives for PBMs to prefer higher list price, higher rebate drugs, which would increase drug spending for employers and their employees. So like all that background, I think we agree on pretty much all of that. What would be our plans to address what PBMs have been doing in having less transparency? How do we make them, and what would our plan be to make them more transparent for employers and consumers?
Congressman, thank you for describing the situation, because I don't think most Americans understand how their drugs are priced and why. You've explained one aspect of it, which is critical, and that's why CMS, as you mentioned, has put forward a rule that would change the way these PBMs price their products so that we're actually going towards the lowest price that's been negotiated versus letting them inflate the price. We're right now in the process of reviewing all the comments that have been received during the comment period for that rule. We hope to be able to move something soon. But as you can see from our rule, we're trying to make sure that we drive the price at the point of sale that the individual, the patient, feels down to what it really should be based on what was negotiated. And so we look forward to working with you, because we have no doubt that folks are going to try to squirm through and find another, escape valve to do something more than provide the best price possible.
Yeah, and I think transparency leads to better quality.
Absolutely.
It leads to a more affordable price. That competition, I mean, to me, I embrace that because I think it's beneficial to everybody concerned if we have, and I think we agree on this.
I concur.
The more transparency, I mean, I don't have a problem, we're in America, I don't have a problem with people making money. The problem is it should be transparent, and that transparency drives higher quality and better customer service and better pricing.
Sunshine is the best disinfectant.
Yes. Thank you, and I yield back.
Thank you.
Thank you.